We're now going to show you a taping for the knee. This is very useful for patients that have patellofemoral joint pain, which is basically pain arising from behind the kneecap, but also for patients with patellar tendinopathy and also inflammation of what's known as Hoffer's fat pad or fat pad impingement. It can be very useful if you get pain when you're running, squatting, or going up and down stairs or up and down hills. First of all, you need to use a product called Hyperfix, which is actually there just to protect the skin and allow a little bit firmer anchoring of the tape called zinc oxide, which is the one that's actually going to move the kneecap into a better position and offload the structures that we've just mentioned. So first of all, the patient has their knee straight with the muscles relaxed. You apply one Hyperfix from left to right and the other one from right to left, ensuring that you lift up the patella, which is the kneecap bone. So they should cross over at the point at the bottom of the kneecap bone. Once you've done the Hyperfix, we then add the first layer of zinc oxide, placing it down at the tibial end and anchoring with the thumb as you pull up over to the other side. The pull of the tape should be going up towards the patient's head, and that allows us to get a small lift onto the patella to ensure that we're offloading those structures and helping pain. We will apply a minimum of 2 layers of the zinc oxide tape, making sure that the direction of pull is slightly outwards and upwards on both of the tapes. If you are going to run with this tape on, it's important to do a few squats first and go for a short walk just to make sure that it's comfortable, it's not digging into the skin, and it's not causing any skin breakdown. Obviously, if that does happen, it's important to take the tape off and start again.